The assessments we did were the Children's Assessment of Participation and Enjoyment, the CAPE, and the Preferences for Activities of Children, the PAC. The CAPE and PAC were created by some familiar people: Jillian A. King, Mary Law, Suzanne King, Patricia Hurley, Peter Rosenbaum, Stephen E. Hanna, Marilyn K. Curtoy, and Nancy L. Young. They created these assessments because they were doing a study of the factors affecting the participation of children with functional limitations and had a hard time finding a comprehensive assessment. They based their assessments off of the International Classification of Functioning, Disability, and Health. There are two assessments we'll be talking about today. The Children's Assessment of Participation and Enjoyment, or the CAPE, is a measure to document how children with and without disabilities participate in everyday activities outside of mandated school tasks. The Preferences for Activities of Children, or the PAC, determines the activity preferences of children. It is an extension of the CAPE, but both can be used separately. The CAPE and PAC can be used for clinical purposes and research purposes, or as an outcomes measure to assess a child's participation diversity, intensity, enjoyment of activities, and preferences. The context that is examined in both the CAPE and PAC is participation. Participation is the context in which children form friendships, develop necessary skills, express creativity, achieve mental and physical health, and determine meaning. For children with disabilities, participation is often a concern. They are at a higher risk for social isolation and lower life satisfaction, which are both associated with low participation. The CAPE and PAC can be used with children ages 6 to 21 with or without disabilities. It is not appropriate for children who are unable to comprehend the task of recognizing and sorting activities. It can be modified by providing assistance with the motor aspect of sorting the cards.
Two methods were used to provide evidence of reliability for the CAPE and the PAC. Internal consistency was evaluated to show that the tasks in the subset measure one construct, and test-retest reliability was used to demonstrate that there is stability of test scores across repeated administrators. There are two options for administering the CAPE and the PAC. One option is self-administered. Parent assists by reading activity descriptors and response options to child. Parent can assist but cannot answer for child. The other option is interview administered. The interviewer reads the activity descriptions and the child responds to each item using activity cards and visual response pages. Primary users who would be administering the assessment are OTs, psychologists, recreational therapists, speech and language pathologists, PTs, teachers, nurses, and social workers. The only requirement for administering is the ability to interview children and establish rapport. Both assessments are relatively short. The CAPE takes about 30 to 45 minutes and the PAC takes about 15 to 20 minutes, so a total of an hour for both. The assessment allows parents to participate by reading the activity descriptions and response options to the child. The parent can assist the child in answering, but cannot answer for the child. The parent can also read the items, but cannot choose them for the child. The components of the test are a manual, one booklet with the CAPE and PAC record forms, 57 activity cards, 10 category cards, and one booklet of CAPE and PAC summary score sheets. 10 category cards include hobbies, crafts, and games, social activities, quiet recreation, organized sports, other skill-based activities, clubs, groups, and organizations, active physical recreation, entertainment and education, jobs, chores, and employment, and other activities. The activity cards depict 5 different kinds of activities that are commonly seen in children: recreational, puzzles, board games, card games, crafts, coloring, collecting computer video games, pets, imaginary pretend play, toys, walks, hikes, playgrounds, TVs, movies. Physical, martial arts, racing, team sports, school clubs, bike riding, water sports, snow sports, gardening, fishing, and other sports. Social, talking on the phone, party, hang out with friends, visiting, entertaining others, movies, live events, outings, cooking, and music. Skill-based, swimming, gymnastics, horseback riding, singing lessons, art lessons, dance lessons, musical instruments, lessons, and dancing. Self-improvement, tutoring, religious activity, writing letters or stories, going to a library, reading, volunteering, chores, homework, and shopping.
If both the CAPE and PAC are being used, the CAPE is administered first. You can use the CAPE and the PAC separately, or you can use them together. As stated before, there are two options to administering the CAPE. It can be self-administered, and it can be interview-administered. For the self-administering, Forms can be mailed or hand-delivered to the child. It includes a cover letter with an explanation of the assessment and its importance, contact information, and a return stamp. If using administrator interview, begin with example item to give child practice answering the questions. To set up the CAPE, category cards are inserted into activity cards. The visual response page is arranged in front of the child with the frequency scale, with whom choices, where choices, and enjoyment scale. The first category card is read aloud to the child, and the activity card is read after. All activities are to be read through. The child is asked if they have done the activity within the last 4 months. A holiday, birthday, or other prominent event can be used as a reference point. If they say no, move through the activity cards until they say yes to the activity. If they say yes, ask how often, with whom they did the activity with, where they did the activity, and how much they enjoyed it. To administer the PAC, remove the category cards from the activity stack. Place the 3 PAC cue cards in front of the child in the order of I would not like to do at all, I would sort of like to do, and I would really like to do. Begin with an example item for practice. Go through the activity cards and ask the child if you could do anything in the whole world, would you like to be doing? Have the child sort activity cards into 3 piles corresponding to the 3 cue cards. Record based on their answers and score. The scores are based on 6 dimensions of participation: diversity, intensity, with whom, where, enjoyment, and preference. The scores are examined at 3 levels: overall, domain, and activity type. Overall is the global assessment of child's participation based on all dimensions. 1 overall dimension for each dimension assessed. 55 items. Domain, which is a measure of formal and informal domains. 2 domain scores for each dimension assessed. 40 informal and 15 formal items. Activity type is a measure of participation at the activity level. 5 activity type scores for each dimension. Number of items vary per activity type. It should be noted that this does not measure the degree of assistance required for child to participate or competence in activities.
The diversity score is the sum of all the activity possibilities for the level being measured. For example, if you are measuring the overall level, there are 55 possible activities. If you are measuring the formal domain, there are 15 possible activities and 40 informal activities. And if you are measuring a specific activity type, the number of possibilities depends on that specific activity. This applies in the intensity score. The sum of all ratings is divided not by the number of activities the child does, but the number of activity possibilities for the level of the measurement. The with whom dimension is the sum of all ratings divided only by the number of the activity the child does. The where and enjoyment dimension are also the sum of all ratings divided only by the number of activities the child does. The last dimension, preference, is a sum divided by the total number of possible activities for the level being measured. The summary score sheet involves all the steps talked about in the scoring participation. Scores for each section are transferred into the summary sheet and calculated based on the dimension. After scores are computed, they are plotted on a number line with graphic representation of where the child falls on the continuum for each dimension. These are Margot's scores on the CAPE. She scored a total of 38 for diversity, 2.8 for overall intensity, 1.9 for the with whom score, 2 for overall where score, and 3 for overall enjoyment score. She shows a moderately high diversity in her activities, a moderately low intensity, a moderately low with whom score, implying that she does most activities alone, a moderately low where score, showing that she does most of her activities at home, and a middle enjoyment score.
The PAC summary score sheet is a little different from the CAPE. The summary score sheet is arranged into 5 activity types. The cards won't be pre-sorted to these types because they will be divided based on the preferences of really like to do, which is a score of 3, sort of like to do, score of 2, and do not like to do at all, score of 1. Therefore, you must transfer the corresponding scores into the appropriate activity type score column. After this is organized, you will find the sum of ratings for each activity type and divide it by the number of items in that activity type. This value will then be recorded in the total box for each column. This value is the preference score for the activity type.
Here are Margot's scores on the PAC. She scored an overall score of 2.4. Her highest scores were in social activities and physical activities, and her lowest score was in self-improvement.
Scores from the CAPE and PAC provide information that can be interpreted by making comparisons with children of the same age or sex in a similar diagnostic group. Scores can also be used to track changes in a child's participation over time and to evaluate the effectiveness of an intervention program. The overall score provides the user with info about the diversity, intensity, enjoyment, where, and with whom of participation and preference for activities. The activity type scores describe the 5 types of activities in which the child participates. The ultimate goal of the PAC and CAPE scores is to direct intervention planning.
There are many benefits to the CAPE and PAC. It is user-friendly for children and parents. It uses illustrations to show children with and without disabilities engaging in various activities, making it accessible and engaging. It provides a way to measure several dimensions of participation from a client-centered perspective. It allows 2 options to administer, allowing for it to be flexible. It can also adapt components of it to suit children with reading or filling out the forms. It can be used with children with visual impairments, motor impairments, hearing impairments, and nonverbal communication.